Hi, this is a healthier Heather, and yesterday was my 1 week post-op after my vertical sleeve gastrectomy. I'm doing great. I'm gonna like to share about my hospital stay and what's going on now. So, as you know, on my last post that I was sick actually before my scheduled appointment for my surgery, and I had some congestion in my chest that I was coughing up that was green and in my nose. And they checked me out right before the surgery and they said, all is go, everything's fine. So they took me in and the procedure lasted about a half hour. It usually lasts from 45 minutes to an hour. The surgeon came out and told my husband that everything went great. He was really delighted by my post-op diet that shrunk my liver, so to keep it out of the way. He said that he wished more patients were like that, but I think what also helped it was that I didn't have any comorbidities. I don't have any hypertension, what is it called, high blood pressure, diabetes, or things like that. And that's actually why I had the surgery, as because I have a history of morbid obesity in my family, and I don't want to come down with those later on down the road. I'd still really like to enjoy my body while I'm young, be able to cross my legs and be able to get on the floor with my kids and things like that. So I'm going to move on to the hospital stay. So yeah, the surgery was great. And when I woke up, about 24 hours, for 24 hours after the surgery, I wasn't able to have any liquids. They did give me like a little stick with a sponge on the end of it so I can keep my mouth moist, which was awesome. I did feel, even though they did have me on an IV, my mouth was still really dry and cracky and things like that. So that's something to be aware of. They did do the leak test. They had me drink something before they gave me liquids to make sure that my pouch wouldn't leak. It tastes kind of like unflavored Robitussin, which is pretty nasty in my opinion. It was a little difficult to get down. You could definitely feel that in my sleeve, how it would go down into the narrower area, and then it would, how there's like a wide portion, a narrow portion, and then it gets wide again down at the bottom. I could definitely feel it go down to the narrow portion, and then the air coming back up. And still, while I was drinking the next day, I could feel it when I was drinking water. I took little sips of water. They gave me these little teeny tiny cups that I could kind of sip out of all day long, which really helped. It kept me hydrated. The only thing is that the day after surgery, it came down with my period, which they said is very normal. So I guess that's to be expected. Unfortunately, it felt like that was taking all the fluids out of me. So yeah, it was pretty good, even though that was something that did cause a little bit of difficulty. I wanted to show my scars from my surgery. You can see them. I do have a lot of stretch marks from giving birth, which, these little scars aren't really much. A lot of the marks have gone down. This is the main scar, which actually still hurts. This is where they actually stretched it out and pulled the rest of my stomach out of. There's a little right here, and also down here there was like a little mark for where they had my pain ball, which is a little ball that they have pain in. It looks like basically like a drip tube that they put like an anesthetic into. Just little ones all over. But they're actually, I don't know if you can see them, they're actually looking pretty good, which is nothing compared to my stretch marks from the 3 kids that I had. And later on, hopefully, if I keep this weight off, I'll be able to get a tummy tuck. Yay! So that'll be really exciting. Okay, let's move on. I had to keep my time short because I like to go over a lot and it's not that great. So it was a wonderful staff at the hospital. My only concern was they really weren't on me. It's not really their responsibility. It's my own to get up and walk every 2 hours and to do the what is it called? The spirometer to get all the crud out of my lungs. Having a cold going into surgery did make it a little harder getting the stuff out of my lungs. It was painful, so I did have to hold a pillow to my stomach and just cough and let it up. They gave me basically like liquid morphine, not morphine, liquid Vicodin. I really don't like it. It makes my head really cloudy and really nasty. I've been off it for about 24 hours now. It was a fight between either do I want to be cloudy headed and yucky, or do I want to be in pain and feel yucky. So that was a lot of difficulty with that. It was difficult for me. I just don't like feeling gross. The nurses were great, except for one of them thrombosed some of my veins, where she was pushing fluids a little too quickly and ruined some of my veins in my arm in one of my IVs, which is, it happens. We're not all perfect. My husband was there with me in the hospital. I did come down with like a slight fever and I kind of panicked. So my husband was there to cool me off and keep me calm, and which was a really great help. So hopefully if any of you go in, you'll have someone there with you to help support you. I do have 3 little kids, so my dad and my mom did come into town to help me with them, which was a big relief. And my mom is still here, even though my dad had to go back home, taking care of my kids. Because my kids are like, I have a 4-year-old, I have a 2-year-old, and I have like an 8-month-old. So the help was really, really needed, especially with bending over and picking up the kids and picking up the toys off the floor and things like that. So that was really good. I really appreciated their help. So the water so far after I've been off the hospital, I've been on this is my 1 week of fluids only, which consists of like clear fluids, which is like chicken broth, beef broth, sugar-free Jello, sugar-free popsicles, and water. The water I've been drinking has been the Smart Water because it has a lot of electrolytes in it, especially lately within the last 48 hours. I've come down with diarrhea. So yesterday I went in, they say diarrhea is normal, but I mean, every time I was drinking some water, it was coming right out the other end, which wasn't fun. But not to this extent isn't normal. So yesterday I went in for testing and I gave them a sample, and it turns out I have C-diff, which I guess is a common bacteria you can get after surgery. So my husband's just bringing me home some medicine tonight, and so about 3 pills a day for the next 12 days, and I should be good. I'm not really worried about it. I'm just glad that it's going to be over with, because it was just kind of a crampy feeling in my stomach. Now, as far as pain, now that I've been off for about 24 hours, my stomach hasn't hurt at all. Like, it really hasn't. It's been great. The only thing that's hurt is the incision site, where they basically stretched out the incision so they can pull my stomach out of it. That's the only part that really bugs me. Even now, though, it's gotten much better than it was originally. Let me think. Anything else? Yeah, other than that, I'm doing really good. My mom's here taking care of me and the kids, and the kids are happy. They're not jumping on me as much. They're being a little more gentle, and know that mommy has an owie tummy. So they've been real sweethearts, and my mom has been too. And yeah, and I really appreciate those of you out there who have experienced and who have shared it. And I hope that this can be a benefit to somebody else who is going through this or is considering it, because I'm ready for this lifestyle change. I can already feel it. I can already feel that it's a choice now. I really do feel that addictions are, I don't know if I mentioned in my last blog, but that addictions are you make a bad choice for so long that you lose your ability to make a choice. You make a bad choice for so long, you lose the ability to make a choice, and then you have no way to gain that choice back. Like, make a choice over eating or, anything, your agency back. So I feel that I needed something to help aid in being able to make choices again, healthier choices for me and my life and my family and for my health, and things like that. So I wanted to say thank you for all those who are out there again, and I hope you guys have a great day.